Hello there. This is Book Talk on Book Place, and I'm your host, Anthony Moirore. And as always, we get to have an author speak about his or her book that she has authored. And today we are having one great person who is a doctor, and she is Dr. Teresa Cody. Welcome to the show, Teresa.
Well, thank you, Anthony. Thank you very much.
Yes, and we are very glad to have you with us on our show. And we are talking about a book that you've authored. It's called You Healing You.
Right.
So, for those who are watching, welcome to the show. This is what we are going to be talking about. But before we even go to the book directly, we would let Dr. Teresa tell us a bit about herself, and then we will go into the book later. Please continue.
Okay. Well, I am a dentist and
Okay.
I am married to a dentist,
Wow,
and we
that's
have a
wonderful.
dental practice,
Yeah.
yes,
Uh-huh.
in Sugar Land, Texas, which is right outside of Houston, Texas.
Oh, okay.
A couple of years ago, I started a wellness center
Yeah.
right next to my dental office.
Okay.
So we have two children, both grown, one married,
Uh,
and so we're kind of looking forward to grandchildren now.
oh, that's wonderful.
Yeah,
Wonderful. It's good when you have a family and you get to see your offspring and the offspring of your offspring. So that's very wonderful to hear that you are looking forward to some glad children, grandchildren very soon.
yeah. So that's the next phase of our life. But
Yeah.
um, so we've been practicing dentistry for about 30 years.
Okay.
So luckily, now I have some associates that are helping out, and so I can be here. And I don't have to be doing fillings.
So right now you're talking to us from your wellness center.
Actually, it's my home.
Oh, okay. Your
I'm
home is
home.
also beautiful. It looks like a wellness center. Okay, wonderful. So I guess you're having people helping you in both areas, in the dentistry and in the wellness center. Then that's why you're home right now.
Right. Yes, I have a nurse on staff and a MD on staff.
Okay.
And so yeah, no, I try to spread the joy.
That's good. That's good. That's good.
So
Now, um,
oh, go ahead.
as yeah, when you talk about dentistry and you also talk about wellness, and are they linked together? I mean, when you're talking about wellness, I thought that as you are a dentist, you are a dentist, and then there is another section of you that you tell us. Please tell us a bit more about the difference between the two.
Okay, well, my husband and I built our practice from the ground up. I mean, a new building in 2011. And when we did that, we added 2 suites to it. So it was bigger than just the dental office. And we rented one of the suites to a med spa
Mm-hmm.
for about 5 years. And then she decided she didn't want to renew.
Okay.
So I was trying to rent the space out to another med spa.
Yeah.
And I fell into wellness kind of accidentally. So I was at my hairdresser's,
Okay.
who I get to see her tomorrow, so I'm excited about that. She had a problem with her right hand, and
Okay.
she had trigger fingers,
Yeah.
and she couldn't make a fist.
Okay.
So she had gotten a steroid shot, and she stopped hurting
Yeah.
for 4 months.
Mm-hmm.
And then all the symptoms just came right back.
Mm-hmm.
So I was sitting in her chair. This is now 3 years ago. Yeah.
Okay.
And she said, I'm going to go get another steroid shot.
Mm-hmm.
I said, well, you can't do that. You can only get 3 steroid shots in one area for a lifetime.
Ah.
And she said, oh, really? I said, no,
Mhm.
it destroys everything in there.
Uh-huh.
So I said, why don't you come into the dental office and we'll put PRP, which is platelet rich plasma.
Okay.
Now, I don't even know why I said it. We use platelet rich plasma in dentistry and we've used it for 30 years.
Okay.
So what it is you draw a little blood and you spin it in a centrifuge and you take the plasma portion
Mhm.
of the blood off,
Okay.
okay, from the
Mhm.
red blood cells.
Mhm.
And then we use that in dentistry for bone grafts.
Ah.
But, um, you know, I've known about it for 30 years, but
Okay.
you put it in there with a bone graft, you let it sit for 3 months, and then you put an implant in. So
Okay.
you, so you get bone.
Ah.
If you didn't use the PRP, the platelet rich plasma, the bone grafts didn't take as well. They
Uh-huh.
disappeared. So she actually said yes. And she came into the office and we drew blood and spun it in the centrifuge and pulled off the plasma portion of her blood.
Yeah.
And I injected it into her hand.
Mhm.
Now, luckily, I took a picture right before I did it,
Mhm.
and uh, and she was showing how much of a fish she could make. It's in the book, the
Okay.
pictures, and she asked me, "So, how long before I see anything?" And I said, "I don't know, 6 weeks." So the next day, I get a text from her, and she sends me a picture and her finger and her thumb were touching.
Mm. Which wasn't happening before.
No, it was, she could not touch. She
Okay.
was like this.
Mhm.
Yeah.
Mhm.
So I said, oh my, what is going on here? So the next afternoon, so
Yeah.
now it's 2 days later,
Mhm.
she texts me a picture of a closed fist.
Mm.
And I said, oh, this is a miracle. I have got to study this. So that's my beginning of my journey into platelet rich plasma.
Yeah.
And that's what the book is about. Like all the uses that we've been able to figure out how to use it and in the last 2 years.
Oh, that's quite interesting. And when you talk about the plasma that you took from the blood that you drew from her, and you tell us about the result that you observed soon as within 24 hours and proceeding. What exactly happened? And maybe we would get a clearer picture of what this plasma actually does in the body. Uh, what exactly?
What it does is it heals you.
Mm-hmm.
That's why the book is called You Healing You. We
Oh,
use
okay.
your own plasma
Yeah.
to heal different areas of the body.
Mm-hmm.
So it turns out after I started studying it more closely, there are at least 15 called growth factors
Mm-hmm.
in the plasma. For
Okay.
example, one attracts stem cells.
Mm-hmm.
Another one tells the stem cells what to become.
Okay.
So let's say you skin your knee.
Mm-hmm.
Um, it is the platelets and the plasma that come and stop the bleeding,
Mm-hmm.
form the clot. Then they proceed to heal the area with, they make skin and collagen and blood vessels. And 10 days later, you look down and your knee is healed.
Okay.
Well, it was all the plasma, the platelets and the plasma.
Okay.
That's what did it.
Yeah.
So it is the way that your body heals
Mm-hmm.
all the time,
Ah,
everywhere.
okay.
So all we're doing is we are concentrating those healing factors in an area.
Ah, okay.
Okay. So This is used regularly in horse medicine.
In what?
Horse medicine,
Okay.
equine medicine for
Okay.
horses.
Ah.
It is, I live on 4 acres and my neighbor has horses. So I'm at the fence one day and I said, hey, I'm opening a wellness center
Yeah.
and we're going to use platelet rich plasma.
Mm-hmm.
And she said, oh, I know all about it. And I said, you do?
Yeah.
She said, oh, yeah. Anytime the horses hurt themselves at all, that's the first thing they want to do.
Okay.
The vet wants to use their plasma because they have very, very long ligaments and tendons.
Mm-hmm.
And tendons and ligaments don't have a lot of blood flow.
Mm-hmm.
So very slow healing.
Okay.
So if you put the plasma right there where the injury is,
Mm-hmm.
it heals up faster.
Ah. Oh, that's good. So that's the concentration of the platelets that makes the healing more faster than it happens before.
Right. Because it is going to happen. You'll
Yeah.
heal up to some degree.
Mm-hmm.
And all we're doing is using your natural healing to increase the rate of healing and increase the amount of healing. We've seen scars disappear.
Yeah.
We've seen, of course, tendons and ligaments heal up. This is also used in sports, professional sports.
Okay.
Yeah, because it's known they'll get back out on the field faster. Right,
Yeah.
because you heal up faster. And they're worth a lot of money.
Wow, that's
We are not.
enlightening. That's enlightening because we are always hearing of some sportsman has got an injury, and within a short while they are back into play again. I mean, within just a few weeks, a few months, the man is up and running again and playing. And I wonder, I mean, if I broke an arm or a leg, it would take me some 6 months to be very active like they are. And so what happened? So now you are pouring out to us a secret that we didn't know before. Thank you.
That's right.
Yeah. So this is
So
what
we
we do.
also use it for aesthetic reasons.
Okay.
Have you heard of the vampire facial?
No.
Well, Dr. Runnels in Alabama, he coined he named it the vampire facial because you use your own blood. So we use it for aesthetic treatments because we want our skin to look better.
Yeah.
And decrease wrinkles and, all those important things in life.
Ah, okay, okay. We are getting that. We are getting that. So and now we are talking about steroids gone and other medicines that were used before that we didn't know gone, and now we use our own blood to heal ourselves, and this is where you healing you comes in.
Right,
Good.
right.
Wonderful. Yeah, because it's not always advisable to be taking all those medicines that are out there in the, I mean, you never know the side effects they are going to give you. So when I hear that something from inside of me is going to be used to heal me, that's quite a good story. That's some quite good news.
I'll tell you the bad news, and this is why you won't find
Oh,
it everywhere.
yeah, we are always ready for the good news and the bad news, but we choose. Okay.
Well, the bad news is most of our medicine is based on what insurance will pay for,
Yeah.
and insurance doesn't want to pay for this.
Ah, why? What's the reason?
You have to ask the insurance companies.
Oh, so
I have been
insurance.
dealing with insurance my entire adult life
Mhm.
in the dental office, and they play a lot of games.
Okay.
That's why they have the biggest buildings
Uh-huh.
and they make the most money
Mm.
because they're not interested in your health. They're
Yeah.
interested in their bottom line. That's why.
And I'm always hearing stories not only about the insurance, but also the medicine, I mean, the pharmacists, but I don't want us
Big
to go that
pharma
direction.
doesn't,
Yeah.
now, this is not interesting to big pharma either, because you have it in you, it's you healing you, you don't have to talk to
Yeah.
them. Um, you know, they try to regulate the centrifuge and how you use a centrifuge.
Okay.
But Anthony, centrifuges have been around for many years,
Mm-hmm.
right?
Yeah.
So they're having, uh, this is like if people say, is this FDA approved?
Mm-hmm.
Well, that's the Federal Drug Agency,
Yeah.
right?
Yeah.
Administration.
Mm-hmm.
Um, so no, Food and Drug Administration.
Okay.
So they regulate food and they regulate drugs,
Drugs. Yeah.
right? This is
Yeah.
your blood. This
So
is
it,
like saying, do
so
they regulate my spit?
so
No, they
so,
can't
so
regulate your spit. They can't regulate your blood.
now I
It
get
has nothing to do with them. It's not a food and it's not
it.
a drug.
Mm-hmm. Now I get it. Uh, let's go back to the healing part a bit. In the case
Okay.
of your friend, and also in the case of many other people, why is there some, I mean, the hand could not, even given the time that the person was ailing, why couldn't it completely heal itself? I mean, is there some, at some point that the normal platelets stop circulating, or, I
No,
mean, that it
I don't think
stops
that
there?
was it. She's a hairdresser and she's been a hairdresser for many years.
Okay.
And there's repetitive motion.
Mm-hmm.
And the body really doesn't like repetitive motion.
Okay.
You know, it's hard on it. And so she was, it seems like the platelets aren't working, but they are, but they're
Mm.
not sufficient numbers to like override the everyday repetitive motion of it.
Ah, okay. Which
If
was,
she stopped
yeah.
hairdressing, if she stopped using that motion,
Mm-hmm.
her hand would probably get a little better.
Okay.
But because she keeps, but now we've only done it, we've done her hand twice in 3 years and it's staying and she's still working.
Ah, that's good. That's a good report.
Mhm. Mhm.
Uh, let me ask a question just to know, because I've heard that there are other body ailments, I mean, some ailments that destroy the nerves and things like that, so that you don't get some quick healing on the wounds. And so you can end up losing some parts of your limbs.
Yes,
So,
diabetic,
mm,
especially diabetic wounds.
yeah, exactly. Especially diabetic one. Could this be a solution to that? They call it the diabetic foot or things like, I mean, is there?
Well, we have treated 2 diabetic wounds
Ah,
and they have they were on their way to healing
mhm.
when both patients kind of, I published the book before we had finished, so we don't see the final wound. But yes, and they went from black, it's called necrotic, it's dead skin,
Yes.
to pink,
Mhm.
and then started healing.
Okay.
So yes, it was a very good solution for a diabetic wound, because the other treatment that's done a lot is hyperbaric tanks. You
Mhm.
get, um, but that treatment was $50,000 for 1 foot.
Okay.
Well, it's 5 days a week, and you have to go into a tank, and you go under pressure, and a nurse has to go with you.
Yeah.
So this was a much easier way. We inject the area and it just healed up.
Yeah, and I guess I don't have to sell my house to go and come and
Right.
get it
No,
for you. It's
we're very
affordable.
reasonable, to tell you the truth.
Okay, that's wonderful. So, at what point did you come up with the idea of writing a book?
Well, after I saw all the miracles that happened
Mm-hmm.
and all the healing, and we've treated uh, many things, Bell's palsy, um, plantar fasciitis, which is
Okay.
the foot, knees, hips, rotator cuff in shoulders.
Yeah.
I I decided I got to write a book because nobody knows about this.
Mm-hmm.
And it's right there. It's right inside you. You're
Mm-hmm.
making it every day.
Whoa.
So that's when I came up with the idea that I'd write a book about and just share this information with whoever needs it. It's I've been able to help a woman in Canada. She
Okay.
had Bell's palsy, and there's a lot of practitioners who do the vampire facial,
Mm-hmm.
which is that aesthetic treatment I was talking about.
Yeah.
So she found a practitioner who did the vampire facial, and they were able to treat her
Mm-hmm.
as an aesthetic treatment,
Okay.
but because it improved the Bell's palsy. So, like, I talked to the practitioner and told her what I did, and so that's when I got when I started. I started it before COVID and started writing,
Okay.
but during COVID, I got to finish it.
When was it published?
It was published last September.
Last September, and it's on Amazon.
Right.
Can we have a
And
look at it? Do you have a copy there? So you know what. So is you healing you. Now that's the book to all those who are watching and listening. You healing you by Dr. Teresa Cody.
right.
You did quite a good thing to write
CODY.
the book. You did quite a good thing to write the book for us so that we can get to know that secret and apply it in our own life.
I know and it is truly a miracle. I've watched it heal up. Just, I mean, it's a matter of diagnosis. Let's say you tear a tendon or you pop a ligament and it's detached from the bone.
Mm-hmm.
Well, this is not going to reattach, right?
Yeah, yeah.
You have to surgically go put it back,
Mm-hmm.
but using the PRP
Mm-hmm.
post surgery will help you heal faster.
Okay.
And they used to use it in surgeries. I've talked to a surgical nurse,
Mm-hmm.
and she said, "Oh, yeah, we used to use it all the time, and they don't, but because insurance won't pay for it, they, I think they forget to offer, the hospital doesn't want them to do it because the patient has to pay.
Mm-hmm.
But you could ask for it because it's not very difficult. This is
Okay.
very easy."
It's always good to have some options that we end up deciding on by ourselves what we are going to take. Now, if I'm going, given the option of taking some medicine which the insurance is able to cover for, and I think that it could have some side effects on my body, and I'm given a more expensive option, which is going to be a solution from within myself, then I think I would better go for that one, which is from me into me.
That's right. You can have a side effect. You cannot have a side effect. It's you. It's your body. And they use plasma. Let's say you had a car accident and a head injury.
Mm-hmm.
They use plasma to stop a brain bleed.
Okay.
Other people's plasma,
Uh-huh.
because the platelets are what its first job is to clot.
Yes.
So it stops the brain from bleeding.
Mm-hmm.
So we just taken it, and now we don't use other people's PRP in you. We use yours. But during COVID, if you think about it, did you hear about the antibody filled plasma that they were talking about treating COVID with?
I didn't get to hear of it.
People that had COVID
Mm-hmm.
donate their plasma,
Mm-hmm.
and they use that plasma in somebody who gets sick, giving them the antibodies.
Mm-hmm.
So that was going on last year.
Yeah.
So it isn't to say that you can't take somebody else's blood, because we do it all the time if you
Mm.
need a blood transfusion. But in our office, we have no need. We just use we take your blood, spin it, take it off, and put it back in.
Oh, okay. And if I may ask, and I know prices do adjust every now and then, but at this point, how much do you charge to for the procedure? For example, on your friend or someone that you did recently.
Well, we start at a very reasonable rate of $200 for
Only.
for let's say a shoulder.
Okay.
And the aesthetic procedures are more than that, but
Yeah, I can
yeah,
imagine that. I can imagine that.
but we start that low because I don't want to take insurance.
I
I have
understand.
20 employees in the dental office,
Mhm.
and right now I don't want any more employees than I have to have. And if you take insurance, it's very time consuming to process it. I have one person who processes dental insurance all day.
Okay. Ah,
Yes,
I,
calling insurance companies, following up.
I can imagine that.
It's a big job.
It's
And
not an easy
so,
task, I know.
yeah.
Uh-huh.
So we are basically a cash practice,
Okay.
because we do vitamin infusions, and we do, it's called like Myers cocktail, and that's B vitamins, and we do also phosphatidylcholine and glutathione. Glutathione is the number one antioxidant that your body makes,
Mm-hmm.
that your liver makes. And phosphatidylcholine is a major portion of your brain.
Mm.
So we're trying, so we do that. So, but mainly we do platelet rich plasma.
Okay,
And
that's good.
that,
I also guess that in other parts of the world, it could be not quite as expensive since it's as simple as you explained it to us. And this is why we encourage someone to get the book to get more in-depth knowledge about it before they make a decision going into it. What topics do you cover in your book so that we get to know what we are going to understand from the book?
well, I cover the background of um, what's in the plasma,
Mhm.
like, and then all the different patients we've treated, and I go through the story basically of how I started the wellness center and how that evolved, because I truly did not plan to start another office.
And I know some of the inventions that have happened in the world were accidental, some of the greatest inventions. So maybe this could be your best apart from dentistry. Now,
Yes.
is also your husband helping in the wellness center now? In the
No, he just comes in for vitamin infusions. I also
okay,
have a masseuse that it rents from me, and he gets massages and vitamins and
okay,
PRP, of course,
okay, okay.
because he his father was very bald,
Yes.
so it is also very good for hair growth.
Ah, really? And I
So
think
yeah,
mine is going away. So,
well, all of ours is going away.
so we need to
I've
get.
had I've had more women for hair loss than men now,
You mean
because we start to lose it right here,
yes?
and And then another patient, she's on a lot of medicine for other problems, which
Okay.
mainly her hair.
Mm-hmm.
So um, she she loves it because she texts me pictures all the time. Look at my hair. Look how much hair I have.
Now, talking on that and other medicines that other people are taking, we are well aware that when someone is going through chemotherapy, they lose hair. Have you worked with any client who has been going through chemotherapy or something like
Well, she's on chemotherapy.
that?
That's
Ah,
why she
oh,
was,
okay,
yeah, it was
okay,
that.
okay.
And so she's very excited because
Mm-hmm.
it's kind of okay to be a bald guy, but women don't want to be bald. I just saw her last week and she's like, could you do this little bald spot right here? And I'm like,
Yeah.
yeah, we can do that.
Oh, so this is great news for everyone and anyone who is experiencing some hair loss. You can
Well, that's
recover.
why I wrote the book because it's everything,
Mm-hmm.
everything in your body. This is the way your body heals, you
Yeah.
know? So I I wanted people to know, look, this is available. And it really does work because God made it. Man doesn't have anything to do with it.
Yeah.
We also use it, we make eye drops
Ah,
for dry
okay.
eyes
Mm-hmm.
because I didn't realize it, but dry eyes is a huge, huge problem
Mm-hmm.
and very serious problem.
Okay.
And so we have a dry eye protocol that we use, and everyone who's used it has gotten better.
Mm-hmm.
And you just have to use it. It kind of depends on the reason that you have dry eyes.
Yeah.
So we have some patients with Sjogren's, which is an autoimmune disorder, and they're never really going to get over the
Mm-hmm.
dry eyes.
Yeah.
But this is such relief that one of my patients, she's like, oh, I forget to use it because my eyes don't even hurt anymore.
Mm-hmm.
You got to keep using it
Okay.
because we're not changing the cause of the dry eyes.
Yeah.
We're just helping the eyes heal up. So
Whoa.
I'm telling you,
That's
every body
wonderful.
part.
That's wonderful. It's a great realization that actually, and it's good that you mentioned that when God created us, He created us all sufficient, and He put everything to function in us to live to a full age. Only that some diseases and some things come and destroy some body parts. And so, if we take that which is healthy from us to make us well in the areas that are not healthy, then I think that's logical. I think that's very enlightening.
Mhm.
Yeah, so is you healing you. And thank you for telling us that the doctor is not going to tell me to use PRP. So I'm going to be the one to look for where it's going to be done and how it's going to be helpful to me. So thank you
Right.
very much. And to all those who are listening, this is a secret revealed to you. The miracle of your body healing you,
Mm-hmm.
or blood. The, I mean, using plasma from your blood to make you heal you. And
Mm-hmm.
this is why we are advising you, please take the book, go to Amazon and search for You Healing You by Dr. Teresa Cody and buy it now. And buy it also for your friends and all for those who are ailing. There could be a solution for a problem that you've not imagined before. So thank you very much. We really appreciate you, Doctor. And before we leave, you can leave us with a few words in summary, something that you'd like us to always remember from this show.
Well, I want everyone to know that you have a miracle inside of you
Uh-huh.
and it's coursing through your blood.
Yeah.
and God made it. And so guess what? It works. Every time we try it, it works. And the worst that could happen is you don't heal at all.
Yeah.
That's the worst.
Mm-hmm.
And we have not seen that. We
Yeah.
have seen not ever. We have seen you, depending on the injury, but we have seen only people getting better. Maybe not completely, because we've damaged ourselves or
Yeah.
overworked it, or
Mm-hmm.
but all we've seen is people getting better.
Yeah. Good. And how many years have you been practicing this so far?
Now it's just 3.
3 years. And we look
Mhm.
forward to experiencing more from you as the years
Oh yeah,
continue to roll by.
I'll have a second edition within another year because we're discovering more and more.
Oh, okay. Have you been invited for the practice? Apart from now, you worked remotely to deal with the Canada issue, I guess. Have you been invited elsewhere apart from your area, Houston? I mean, Texas, that is.
Not yet, but maybe in the future.
Okay, someone watching this video is going to follow you and is going to request you to come and do it, or come and give a speech, or come and enlighten people somewhere where they are not aware of this miracle inside of us. So thank
Well,
you very much. Yep.
thank you.
Yes, we really appreciate your presence on this show. And thank you for letting out the secret to us.
It's right here.
Yes, you healing you. And we wish you all success in all that you do. And we wish your clients, your patients in this case, quickest recovery in every area that they are ailing. So thank you very much. And to the
Thank
viewers,
you.
thank you also for watching. And yes, let the miracle work in you. Bye for now.
Bye bye.
Bye.